Italy receives Cuba's second medical contingent to help in the fight against COVID-19. Brazil records first coronavirus death at a newly built field hospital. And Ecuadorian police make the grim announcement that more than 1,000 bodies have been retrieved in Guayaquil. Hello and welcome to Telesur. I'm Carla Gonzalez in Quito, and this is from the South. A second group of Cuban doctors has arrived in Turin, Italy. They arrived Monday morning at the Turin-Casale airport to collaborate in the fight against COVID-19. The latest team of Henry Reeve medical specialists was greeted by the city's mayor and other authorities. The first medical brigade from Cuba arrived on March 22nd and worked at an emergency field hospital in Lombardy to support local hospitals which had been over capacity. Also in Cuba, prevention is the most important step of the government's strategy to confront the pandemic. As part of these efforts, 28,000 young people are going door to door to identify possible COVID-19 cases. So let's look at that story. In the neighborhood Nuevo Miraflores in Havana, in times of pandemic, these images are common. They're students of the Latin American School of Medicine. They came from Palestine, Namibia, Congo, United States, and Puerto Rico. They knock on every house door in this community to find out if there's someone with respiratory symptoms chasing the COVID-19. The idea is not waiting for the cases to show up in hospitals. Instead, they want to find them first. That's the job of these students from Puerto Rico, who says she's living a learning experience. She told us that her parents are far away in the United States and they worry, but she takes care of herself. She doesn't enter the houses, talk from a safe distance, and uses a mask.
They know that as much as they tell me not to do it, I'll do it because I'm fulfilling my duties as a medicine student and as a future doctor.
Isahira told us that after studying biology at a university in New York, she decided to come to Cuba because she was interested in the Cuban preventive approach in health services.
In our countries, that approach doesn't exist, because it is much more profitable to treat a person with a much more complicated disease or a chronic disease, but here we cannot let a patient get seriously sick because we don't have enough resources to treat those people. That's why we have to prevent those diseases.
The young Puerto Rican explains that the decision to study in Cuba surprised his family that is not politically active. She refers that in 3 years she has learned about solidarity and to defend her rights.
I have learned that with very little resources one can do a lot, and that the best thing we have is the human resource. And sometimes our countries are poor or we don't have all the resources, but when we work together and there is a political will, it's possible to do better.
The main thing we have in Cuba is how ahead we are in what's going on, so we have an advantage in front of the situation.
For Isahira, comparisons are unavoidable. She explains that in the United States, where their parents live, not all people can get tests because many do not have medical insurance. This Boricua dreams to see a family physician for every community in her country, Puerto Rico.
I like the attitude Cubans have. Even though they have many difficulties, the Cuban spirit never breaks. Cubans are always joyful. I like that. They are true fighters.
I read on Twitter that you're studying to be a doctor because of Fidel.
The Latin American Medicine School is a project founded by Commander Fidel. He visualized it, and I do not think there is another country in the world that provides this opportunity. A lot of hypochlorite, a meter of distance, and everyone staying at home. The best thing they have done, this activity inquires and being obedient and fulfilling all the measures and trusting in God and in this revolution that this virus will leave, that's the only option.
Hopeful in the midst of this hard situation, this is the Cuban attitude that Isahira admires so much in the people from this island.
Fabiola Lopez, Telesur, La Habana.
St. Lucia has been working to track the source of transmission and prevent deaths, as all cases are reportedly covering well. A partial shutdown remains in place until April 26 with a 10-hour curfew.
As of April 12, 2020, St. Lucia has recorded a total of 15 confirmed cases of COVID-19. The first 2 cases were repatriated to the United Kingdom between March 24th and 25th, and 4 of our remaining cases have since recovered and discharged from hospital care. Last week, the public health team at the Ministry of Health also took the opportunity to step back, review what has been put in place, access our position in that famous curve, analyze the data so far, and prepare the strategic pathway on the way forward with our national response for COVID-19.
Prime Minister Alan Chastanet announced that in addition to grocery stores and other essential services, hardware stores and home suppliers will also be open during the coming week in preparation for hurricane season.
We're now going to be opening up hardware stores, and also we're going to be opening up, I think we call them home suppliers, to be added to the list. And this is again in preparation for both the drought that we're facing, as well as in preparation for the upcoming hurricane season. So again, let's use the time wisely, as the CMO indicated.
Antigua and Barbuda has praised Venezuela for its donation of testing kits and reagents to the Caribbean island to fight COVID-19. This as the country has joined a growing list of nations struggling to receive medical equipment from the United States.
The first coronavirus victim in one of the new fields
the Bolivarian Republic
to fight
of Venezuela.
the crisis passed away.
They brought us 3,000 kits, and these are rapid testing kits. So we have asked the health officials, to include those who operate the laboratories, to ensure that they are utilized. I know that they are primarily interested in those from Peru, but we have had difficulties getting them out of the United States. We've been told, though, that the 1,000 testing kits, potentially we may be able to get them out next week. But again, there's some uncertainty, and as you know, there's some disruptions as well in the supply chain. So we have asked the officials here to utilize the initial 2,000 kits that we got from China, plus the 3,000 that we got from Venezuela. My understanding is that the Venezuelans even provided us with reagents as well, so we should be able to do our own testing.
In Brazil, field hospitals are being built to house patients of COVID-19 in Sao Paulo, and the first death has been reported. Our correspondent, Vladimir, has more.
Today in São Paulo, the first coronavirus victim in one of the new field hospitals that's been put up to fight the crisis passed away. Now, what was interesting about this is that the city governments built 2,000 hospital beds in 2 different locations in the city in tent hospitals. And when it was announced that the person passed away, they also said that only 3.6% of these hospital berths are being used at the present moment. This is interesting because initially last month, scientists predicted that the São Paulo public hospital system was going to crash by mid-April. So it looks like the isolation orders, the lockdown orders by the governor and the mayor, who've been fighting with Bolsonaro, who's trying to end them, are actually working. Now, last week, a study came out showing that only about 50% of the people in the state of São Paulo, which is home to 20% of Brazil's population and is the epicenter of coronavirus right now, were obeying quarantine orders. The governor adapted stronger measures, and over the course of 3 or 4 days, the percentage of people following self-isolation guidelines rose to 59%. So what it looks like is that the quarantine that was ordered by Mayor Bruno Covas and by Governor João Dorio is beginning to work a little bit.
That was Vladimir from Brazil. In other news, a fundraising telethon was held in Jamaica on Sunday evening called Together We Stand, to raise funds to purchase personal protective equipment and supplies for frontline workers fighting the COVID-19. There was a variety of music performed by national artists, some of whom performed on stage and others joined from home. Jamaicans outside the country were also urged to contribute. The Ministry of Health and Wellness has confirmed there are 72 cases and 3 newly diagnosed patients.
With God on our side, true love will abide.
We're taking a short break now. Don't go away.
Innovation, science, the technological breakthrough, and its influence in society.
Viajeros del saber, el futuro está aquí.
Atomy. Monday, only on Telesur.
Welcome back. More news at this hour. Police in Ecuador say they have retrieved more than 1,000 bodies in recent weeks from homes in Guayaquil, the epicenter of the country's COVID-19 pandemic. Authorities in the city are digging graves as the disease has overwhelmed hospitals and funeral homes. The Joint Task Force for COVID-19 in the city did not specify the cause of death for the victims, but estimate that COVID-related deaths will reach 3,500 just in the province of Guayas, which accounts for 72% of those infected. According to official figures, Ecuador has 7,500 cases and almost half are in Guayaquil. Meanwhile, the country has recorded its first case inside a prison. A guard from the Inca prison in the capital Quito tested positive and is under quarantine in his home. The National Court is asking judges to consider other measures for inmates than the preventive detention to contain the spread. The government of Mexico City is working to aid homeless citizens during the pandemic. Brigades of workers wearing protective equipment are convincing the city's 4,000 homeless people to go to shelters, which are being expanded. Workers are also delivering packages of medical supplies like thermometers, face masks, and paracetamol to people who have called the government hotline reporting symptoms of COVID-19. Authorities of the city of 21 million people are recommending those with non-urgent symptoms to isolate at home, not to overwhelm the health system. There are now over 14,500 confirmed coronavirus cases in Africa, with almost 800 reported dead and about 3,000 having recovered. African countries are continuing to implement measures to curb the spread of the COVID-19, while the continent has recorded the lowest number of infections compared to the rest of the world. South Africa and Egypt remain among the most affected, with above 2,000 cases. In the Democratic Republic of Congo, cities are being disinfected to curb the spread of the coronavirus. In Kinshasa, firefighters have been disinfecting public spaces, taking advantage of the lockdown imposed by the government. For 10 days, the fire brigade and the Ministry of Health will disinfect close to 3,000 hectares, hoping to slow down the rate of infection. According to the World Health Organization, the DRC has confirmed 223 cases of COVID-19 with 20 deaths.
At the moment, we are decontaminating the city of Kinshasa during this period of confinement of the commune of Gombe. The goal is to decontaminate secretions, dirt, and where people touch. People touching can contaminate places, buildings entrances. They can spit here and there. That's why we're doing this, to try to minimize the impact of COVID-19.
Amid the current global crisis, parts of Africa have been invaded by a second wave of locusts, 20 times larger than the first outbreak. Billions of young desert locusts are spreading once again, destroying new-sprung crops following seasonal rains. The United Nations has since raised its aid appeal for $76 million to $153 million to take immediate action against the pests.
We are likely to have a two scenario, the corona effect and the food insecurity in the country, because most of the affected areas in the country, the crop, the vegetation, the pasture, the rangeland has been seriously affected, and that combined effect can have a disastrous catastrophe in the country.
They are being a menace, eating our grass and even getting to our manilladas. When the animals eat the grass where the locusts have defecated, they fall ill and some even die. When we slaughter our livestock, we find locust faces on their stomachs. Without a doubt, I think they're affecting our health, animals' health, and the environment as well.
Spain has started easing lockdown measures as the COVID-19 starts to show signs of slowing down. The country's health ministry announced that the number of people dying from the COVID-19 has further fallen by 517. Spain also recorded the lowest number of new daily infections ever recorded since March 20th. Businesses have started to slowly reopen in the capital, Madrid.
There is a lot of people who are going back to work today after this paid leave, and on their return, they are going to meet the civil guards who are trying to ensure their safety, and moreover, who are helping to distribute the appropriate protective materials as they try to get to work. I can tell you that so far, the day is passing with complete normality.
British Prime Minister Boris Johnson has tested negative for coronavirus as he recovers at home after being discharged on Sunday from the hospital. He was initially admitted with persistent coronavirus symptoms and later moved to the intensive care unit when his condition had worsened.
The effort and the sacrifice.
Vocational school teachers in Turkey have joined the fight against COVID-19. 3 public schools in Istanbul have been recruited to produce 15,000 protective face masks a day. Face masks are compulsory in public spaces such as supermarkets and public transport and are being distributed for free by the government. Turkey has reported over 50,000 cases of the novel coronavirus and over 1,000 deaths.
We are producing and distributing these masks free of charge for the people of Istanbul, especially for those who have to use public transport or those who are disadvantaged and cannot easily acquire the masks.
We have more stories coming up. Stay with us.
A review of the world news that investigates, incites analysis, and induces criticism, because every event has a context.
Pusimos el punto en I.
Dotting the I. Saturdays, only on Telesur.
In Russia, President Vladimir Putin has expressed concern that the nation is facing a surge in the number of patients seriously ill from COVID-19. The number of cases is reported to be growing steadily by 16 to 18% a day.
We see that the situation is changing daily, and unfortunately, it's changing for the worse. The number of infected people has increased. Moreover, there are more and more severe cases of the disease. I have already said that the upcoming weeks will be determining.
China has reported the largest number of new coronavirus cases in 6 weeks. The Chinese Health Ministry announced 108 new confirmed cases, of which 98 were imported. The new surge in cases is the largest to be recorded since early March. China has 867 new confirmed cases imported from abroad, including 38 severe ones. The coronavirus death toll in Iran has raised to 4,585 after 111 more patients have been reported dead. Iran's Ministry of Health also announced that the country is reopening government offices outside Tehran to help contain the outbreak. More than 40,000 people have, however, recovered from the virus.
1,617 new cases of COVID-19 have been confirmed, and considering that number, we have 73,303 confirmed cases across the country until today noon.
In the United States, 5 days after ending his presidential campaign, Vermont Senator Bernie Sanders has endorsed former Vice President Joe Biden as the Democratic nominee. This serves as encouragement for Sanders' loyal supporters to rally behind Biden as well. The two former rivals appear via live stream on split screens, talking to each other, where Sanders told Biden, "We need you in the White House, and I will do all that I can to make that happen." Stocks have opened lower on Wall Street once again as the United States reached record COVID-19 cases. The S&P 500 index fell by 1% early Monday after it had surged 12% last week. Stocks fell despite oil prices having improved after major oil producers agreed to cut output as way of cushioning the slowdown caused by the coronavirus. The COVID-19 pandemic in the United States has disproportionately affected minority groups and those who live under fragile economic conditions. The Latino community in New York City accounts for 34% of deaths, as members of the community often lack access to proper health care. Many are also struggling with the downturn in the economy, having lost their jobs, which often require them to leave home. African Americans are also falling victim to the virus in large numbers, as many report discrimination in medical centers. Experts say the pandemic has exacerbated many of the social issues of an unequal society.
I was working on construction, but because of this, the work was stopped because of the coronavirus. We can't be like this together because you never know who has the virus.
This will last until the month of July, so I don't know what to do. I survive because of the organization that gives us food.
Pakistani authorities are raising concerns over the rise in reports of sexual abuse against school children by religious leaders. Police confirm they have received dozens of reports of alleged sexual harassment by religious leaders who run illegal community schools. Several of the institutions are not registered and there is no clear law to regulate their conduct.
Being a doctor, I suspected something, and I shifted that baby to the isolation room for further examination. And when I examined the baby, he was also having some other issues relating the sexual assault.
When that victim will be grown up and he will come into the society as a professional or something else, then people will start tagging him that this is the person who was physically or sexually abused. So there are some shame elements which compel the parents that they should hide the crime.
And with that, we end our news brief. But you can find these and many other stories by checking our website, telesurenglish.net. And be sure to also follow us on social media. For Telesur English, I'm Carla Gonzalez. Thank you for watching.